911 emergency.
Hi, I'm concerned about a friend of mine who's going through a lot of stress right now. I'm really worried.
Crisis is an individual's perception or experience of an event that is so difficult they aren't able to use their typical coping skills. We all have certain things we do to cope with stress every day. When someone is in a state of crisis, the things they normally do to cope with stress are no longer working.
Law enforcement officers commonly respond to incidents involving people in crisis. However, the officers are not educated to treat those dealing with mental illness. What we are trained to do is chase bad guys down and take them to jail. Officers are necessary to maintain social order, but sometimes people in a mental health crisis have behavioral problems that appear to be similar to those with criminal behaviors. Often the solution has been handcuffs and either a trip to jail or a trip to the hospital. Imagine your vehicle having a mechanical problem. You take your car to the only mechanic available who tells you he's only had 32 hours of training, but he'd be glad to give your car a thorough exam and repair whatever problem he finds. In 2018, recognizing that we had a problem, ADAPT and the City of Roseburg applied for and were awarded a 3-year grant to start a mobile crisis team. This team made a significant change to the way our crisis calls were dispatched in Douglas County. This mobile crisis program allows 7-day-a-week coverage for officers to be able to call on the educated assistance of qualified mental health professionals.
All right, Judy. And are you concerned that Dakota might be considering doing something to harm himself tonight?
Yes, I wasn't sure what to do, so I decided to call you. I hope this is right.
Yes, of course. This is the right number to call, Judy. We'll ask someone to check on him for us, okay?
If a concerned friend or family member calls 911, they'll reach dispatch. The dispatcher has a series of questions that he or she asks in order to try to determine who the best person is to respond to the scene. Sometimes it may be an officer, sometimes it may be the therapist, and sometimes it may be both. When that determination is made, the officer and/or therapist are dispatched to respond to the area and make contact. Once everyone arrives at the scene, they meet to discuss the circumstances and assess any safety concerns. Contact is then made with the person. The officer makes an introduction, explains why they're there, and then the mobile crisis team is introduced. At that point, the therapists take over and the officer steps into the background until the determination is made that the therapist feels safe. The officer then can return to normal duties, responding to emergency calls for service.
ADAPT's mobile crisis response is provided by a team of trained mental health providers. We use a team of 2 providers, typically 1 crisis therapist and 1 crisis case manager. The team works in coordination with each other to reduce the individual's experience or perception of crisis, which can work to return the person to a state where their normal coping skills are working again, while also providing them with resources and options for follow-up care. Mobile Crisis allows us to provide community-based services to restore functioning to people experiencing mental health crisis in their existing environment. A community-based response can result in decreased arrests and hospitalizations for people experiencing a mental health crisis, while also reducing the length of time law enforcement spends responding to the mental health call. The focus of our mobile crisis response is on nonviolent calls that may not always require a law enforcement intervention. These are calls that come in through the 911 call center that can often be resolved without law enforcement response. These calls include welfare checks, responses to people feeling suicidal, people who might be causing a disturbance at a business or other public location, or family disputes that require mediation or conflict resolution. We found that a mobile crisis response allows us to provide frontline therapeutic support when and where it's most needed. Our hope is when we provide a community-based crisis response, we can prevent mental health crises from becoming mental health emergencies. One of our goals for a mobile crisis response is to have fewer repeat calls for service from the same individual. When people are connected to mental health services during a crisis response, we can provide people with resources to use in future mental health crises, such as the local 24-hour-a-day crisis phone number. This means people may be less likely to call 911 themselves or be the subject of repeat complaints. We're then able to give people, family supports, and community members another option. They have a name and a face of someone they've met before who can help them problem solve, rather than calling 911. Last year, we provided mobile crisis intervention in coordination with law enforcement to 218 different individuals. We've received excellent feedback from individuals who have experienced crisis, their families, community members, and the responding officers. This feedback highlights the efficacy of a mobile crisis response in resolving crisis without the need for jails or hospitals, and then getting people into services that might prevent further crises from occurring.
The purpose of the mobile crisis team is to divert those in need away from the jail or hospital and allow them to remain safely in the community. Each law enforcement agency in this county supports ADAPT's efforts to provide a better response to our citizens with mental health issues who need help. In the past, law enforcement was the only solution. Now, we're working with ADAPT to be more effective in our community.
Hopefully we can get him the help that he needs tonight, and I'll ask the officer to follow up with you when he's clear. Thank you again for calling.
Okay, that sounds so good. Thank you.